Guest is talking about things like Chat GPT, and he's saying people want sometimes they use it, want to write the perfect cover letter. Well, if an employer wants to hire you because you used this to write a perfect cover letter, is they're not hiring a competent person that can write their own decent cover letter. So, I wouldn't want to work for that employer, and of course, I wouldn't be that kind of employer. This guy is also saying, oh, people use those things as their personal therapists because he says half of the people in the States don't seek out mental health, services of quality. He thinks that once you seek it out, you have it, and that's the thing. Is we were hearing recently in the news on CBC about paramedics committing suicide. Now, if mental health workers, psychiatrists or psychiatric nurses, or just people that work in lower levels but who are not either more or less competent than the higher levels of mental health service providers, if they started having a lot more transparency in their own mental health struggles, and if it made the news, then it would break down this guy's delusions, because he has delusions. If he thinks that once you seek out mental health services, they're of quality, they're not. And more of it, my theory explains it, is domesticating the person instead of getting to know them, understanding their whole person, and how to better help them. Like, I'll have to fire a doctor for a second time, and if there's a way I can say the reason why, I would say he is a Hippocratic Oath and non-compliant. And it's easy to demonstrate this. It's easy to show what I mean by that. And it's justified that I do it. For that reason, right? I want to send that message that he is like that, but also the appointment I have with him is not currently needed. So I'm saving time on his schedule. But I also don't want the procedure done at this local hospital, which again I've documented many times is so cold, is so lacking in the effort of connecting, let's say, with strangers that show up. It's almost like 60% of people that work at that hospital, they wish the people that came in as patients were their friends and family. I don't think they want strangers to show up. That's how intellectually lazy they are in their social skills to connect with a human being that may be a long-term resident here, but they don't know. And that this person might not have no friends or family, and they're counting on some warmth in the services, and it's not offered here. That's another reason. There's many reasons. But you know that I might be labeled as being mentally ill for refusing services, even though there's very valid reasons that I do it. One of them is culture repair. Like, when you send that message to the doctor and the health authority, is you need to do better, right? Doctors need to care more. And same thing, mental health service providers. And when they don't, they just keep breaking the system. And there's a lot of ways that somebody like me, a socio-cyberneticist, can describe this. And these are the conversations. It's not just having a family doctor, or just having access to mental health services. It's that it is actually useful in the way that it's offered, the services from these professionals. Otherwise, it's counterproductive. And it's not just counterproductive to the patient, it is to the doctors, because they don't even know how they're creating broken systems and they're affecting themselves in negative ways. Same thing with mental health workers. They don't know what they're doing to harm others and themselves.